74. We have two very, very good indicators like infant mortality rate, one from 145 decreasing to 28, and maternal mortality rate to 97, which is phenomenal. So that's a decrease of almost 70%. So all of this has happened because of many good processes, many good policies which has brought in by the government of India. There is a good index which we are seeing as a security index, which we have increased to 66. Your question towards which could be broken down into quality, affordability, and definitely access is important. So we have seen that there is a national quality assurance scheme, standards where government district hospitals are adhering to it, and there are 2,600 hospitals which are already certified. We are looking at Lakshya program where maternal and quality care for newborns are there. So 700 plus hospitals have been certified. We are looking at Kaya Kalp, which has been released from Government of India, which looks at hygiene and infection prevention, and there are 2 lakh plus hospitals which are already accredited. There is a national accreditation board for hospitals where almost 1,500 plus institutions are there. Plus there are international. So quality-wise, I think there is a lot of demand as well as deliverable. To your question regarding affordability, if you just, I think almost we were on an out-of-pocket expenditure for 80%, which is decreasing to almost 50 to 52%, and the aim is to get to 42%, where the global average is 18.2. I do understand that there is a question regarding affordability because the healthcare cost is rising. There was a decent study which was done by FICCI where they have seen 2 government hospitals and rest of the private hospital, and the costing was compared. And to our surprise, we think that those are free beds and free hospitals, and you and I are paying for it. And it was close to 18,000 rupees per bed per day maintenance in a government setup, which we think it is free. So there is a healthcare cost which is there in private, which is unfortunately increasing. There needs to be a monitoring mechanism. There needs to be some kind of a regulation at that level. There needs to be standardization of care which needs to be provided. And with all of this, there would be some restructuring which would happen.
Right. Also, I want you to throw light on the medical tourism, which is India has a huge potential for it. And if I quote the number, foreign tourist arrival on medical purpose in 2020 stood at 1.83 lakh, and now in 2023 the number has gone to 6.35 lakh. What is the potential, and how do you see the medical tourism as of now, and what more can be done to boost this aspect?
So it's a close to $125 billion industry, and India captures almost $13 billion within this, and it's a huge market. India was ranking close to 77, now it has come up to 10, ranking with Canada and France doing excellent work. So overall, I think there is a huge potential, but then there are challenges. So most of the patients basically are coming from Bangladesh. 60% of the medical value tourism is from Bangladesh or from GCC countries or from Africa, Kenya, Nigeria, Tanzania. There are some newer boundaries which have opened up, which would be CIS and Georgia and countries like that. So what needs to be done is that needs to be a regulated regulatory mechanism, because it's very individual and it is very facilitator-driven market, which needs to be reorganized, which needs to be restructured. The medical visas, which is generally given, so there needs to be a single stop arrangement with a lot of infrastructural push, a lot of promotions to prevention of health. There is a very good program which is being initiated by Government of India, which is Heal in India and Heal by India, so which is looking at both modern medicine and traditional medicine. Plus, there is a huge talent both in faculty as in staff within the country. So that way, I think that there is a lot of potential. What needs to be done, to your question, I think it is important that B2B, B2C business. Other than G2G business, the government to government business has to happen. It is right now a single facilitator who brings in the single patients and then he manipulates. If it's happening in bulk, 300, 3,000 patients coming from a country, and that's the potential.